into the winter season, it's the perfect time to get your flu shot. Unlike the common cold, the flu can be severe and even life-threatening. With more on the importance of getting your flu shot, in this sponsored segment is McKenzie Johnson, who is the nursing program manager at Den.Health. Welcome in, McKenzie.
Hi, thank you for having me.
Very important stuff. So before we get into it, tell us a little bit about yourself and a little bit about Den.Health.
Yeah, my name is McKenzie Johnson. Like you said, I'm the RN program manager of the Immunization and Travel Clinic at Den.Health. We have a brick and mortar clinic on Den.Health's main campus where we provide routine vaccines for people of all ages, travel consultations for those traveling internationally, and we also have an outreach team that goes out to the community to provide routine vaccines to those that may not be able to travel to Den.Health's main campus.
Awesome, I love that. And when you do go overseas, you have to get different kind of shots and things like that. So that's where you would go if you need those type of things.
Yes, exactly.
Important to know. So why is it important for people to get their flu vaccines every year, especially as we head in to the flu season, which is kind of right now? Would you say so?
Yes, as those that don't know, the highest cases we see are October through April. Every year, the World Health Organization works with 152 different influenza surveillance sites, and the FDA uses the information from those surveillance sites to produce the flu vaccine. So after the last year's flu vaccine, your immunity wanes, so you may not have protection for this season, and those strains do change. So we recommend a flu shot every year so that you have the best protection.
And some people think the flu shot just prevents like a bad cold, right? So can you explain how serious it is to get that flu vaccine?
Yeah, this is a great question. It comes up a lot. Most people associate flu with fever, cough, runny nose, sore throat, just body aches and tiredness. Right. It can cause ear infections, sinus infections, and in severe cases, secondary bacterial infections such as pneumonia, which can lead to hospitalization for days or weeks. And as a previous ICU nurse, it wasn't uncommon for me to commonly see flu patients admitted for treatment.
Okay, so who should be getting the flu vaccine? Who's a top priority?
Yeah, those that are 65 years of age and older are our biggest at-risk population. Those with a lot of health conditions such as asthma, diabetes, congestive heart failure, pregnant women, and children 5 years of age and younger.
And speaking of that, congratulations.
Thank you.
You are pregnant and you did get your flu vaccine.
Yes, it is extremely important for pregnant women to get the flu vaccine as you have decreased lung capacity once your baby gets bigger, and it makes it harder to take those big deep breaths, so having a respiratory virus is very severe in pregnant women.
Yes, because we have two little ones, one running around right now, but my wife was very, very skeptical of different things when she was pregnant, so there's nothing really to fear.
No, it's completely safe in pregnant women to get the flu vaccine.
Completely safe. What do you say to people who say, every time I get the flu vaccine, I feel like I have the flu? Is that common? I feel like I hear that all the time.
I think that is the most common question we get from anyone. It's natural for your body to develop an immune response where you may feel tired, achy, have that low-grade fever, and that's great. It's your immune response building those memory cells in case you're exposed to the virus. Some people don't have that, and that doesn't mean the vaccine didn't work for you. So say you got your flu shot today, and then you're going to be spending the holidays with a lot of people. You may get exposed tomorrow, which means you didn't have that full time to get your immune response, but that doesn't mean the flu vaccine didn't work for you. It just decreased the severity of illness for you, but you didn't have your full immunity, so you did still contract the flu vaccine.
So where should people go? Obviously Den.Health, but they could go anywhere to get the flu vaccine,
of course.
Right?
All commercial pharmacies are carrying the flu vaccine this year, most primary care offices, and then Den.Health has the flu vaccine.
And does it, this is just a personal question, does it separate from like the area you live in, or is the flu vaccine standard throughout the United States for the year?
Throughout the United States, it's standard throughout the year, yes.
Okay, so Den.Health is going to have all the good stuff that you need.
Yes, and so if you're going to Ohio or New York or California, you'll be protected.
You just need to get one.
Yes.
And where should people go if they need to get their flu shot, no matter where they're at? Would you steer them to Den.Health?
Of course I would. The Immunization and Travel Clinic.
Well, there you go. McKenzie, thank you so much. Important information, and congratulations again.
Thank you very much.
All right, guys, protect yourself this season by making an appointment for a flu shot through Den.Health. Give them a call at 303-602-3520 or visit them online at den.health/flu. Again, thank you to Den.Health for sponsoring this segment.